The following is an Investor Brand Network audio production via our audio press release solutions. As a multifaceted financial news and publishing company, Investor Brand Network utilizes its network of more than 5,000 distribution partners as well as other corporate communication tools to introduce public and private companies to a wide audience of investors, consumers, journalists, and the general public. Investor Brand Network's platform connects the investment community with companies that have great potential and a strong dedication to building shareholder value. The following audio press release may feature a client partner of Investor Brand Network. Investor Brand Network may have been compensated for the production of this audio production. Please be sure to read our entire disclaimer for full disclosure. NetworkNewsWire presents Investors Eye Next Gen 3D AI Imaging Technologies in Growing $9 Billion Market. Artificial intelligence is making inroads into every corner of medical technology, perhaps none more urgently than imaging. In breast cancer detection, where early diagnostics can mean the difference between life and death, AI-enhanced modalities present a chance to leap beyond the limits of mammography, tomosynthesis, and MRI. Globally, breast cancer remains one of the most common cancers in women. According to the World Health Organization, more than 2.3 million women were diagnosed with breast cancer in 2022, and approximately 670,000 women died from the disease globally. In the United States, the American Cancer Society, or ACS, projects that 316,950 new invasive breast cancer cases will be diagnosed among women this year. The urgent life-saving need for earlier and more accurate detection creates a powerful opportunity for innovation in diagnostic imaging. Amid this global challenge, companies advancing breast cancer diagnostics are entering a high-impact field. Among them, Izotropic Corporation, IZO on Canadian Securities Exchange, or IZOZF on OTCQB, stands out with its next-generation IzoView breast CT imaging system, a dedicated 3D imaging platform designed to improve detection accuracy, particularly for women with dense breast tissue. IzoView joins an elite group of companies, including Hologic Inc, GE Technologies Inc, Nano-X Imaging Ltd, and Oracle Corporation, that are focused on playing a transformative role in the use of AI in the medical imaging sector. Izotropic Corporation has advanced its plan to commercialize IzoView, a dedicated breast CT scanner purpose-built to address dense breast imaging, a high-priority and underserved segment. One of Izotropic's key selling points is that IzoView is engineered for economic scalability and extensibility. Izotropic's strategy relies on a proprietary AI image reconstruction algorithm trained over 15 years of specialized breast CT data and held as a trade secret. Izotropic's vision for IzoView extends beyond imaging hardware. It is structured to become a node within the large AI-enabled diagnostic ecosystem. According to analysts, the global breast imaging market is projected to grow at approximately 8.6 CAGR between 2023 and 2030, reaching approximately $9 billion by 2030. AI and 3D imaging, the new frontiers of detection. The convergence of AI and three-dimensional or 3D medical imaging marks a turning point in diagnostic medicine. While traditional mammography has been a life-saving screening tool for decades, it is inherently constrained by two-dimensional projection format and the physical compression required to visualize internal structures. In dense breast tissue, present in more than half of women, lesions can be obscured or distorted, leading to reduced sensitivity and delayed detection. Research confirms that dense fibroglandular tissue can mask or mimic breast cancers, thereby lowering diagnostic accuracy and increasing the risk of missed cases, with one study reporting that mammography performance declines significantly in dense breasts, as overlapping tissue often conceals malignancies. The emergence of AI-driven image reconstruction and analysis now offers a transformative solution to these long-standing challenges. Advanced algorithms can enhance contrast, reduce image noise, and identify subtle patterns invisible to human interpretation. AI-based methods have also been shown to improve CT image quality while maintaining or reducing radiation dose. producing clearer and safer diagnostic results. In breast imaging specifically, recent reviews highlight that deep learning systems can augment or even match radiologists' performance in lesion detection, segmentation, and classification, particularly in dense tissue or early-stage disease. This integration of AI with volumetric imaging technologies such as tomosynthesis, MRI, and dedicated breast CT signals a broader shift toward intelligent diagnostics capable of generating and interpreting 3D data simultaneously. Radiology experts anticipate that AI will continue to revolutionize accuracy and efficiency across medical imaging, supporting clinicians in faster and more reliable decision-making. Within this environment, Izotropic's IzoView breast CT imaging system is designed to operate between digital breast tomosynthesis and MRI, combining high-resolution volumetric imaging with proprietary AI reconstruction technology. Its trade secret algorithm, built on more than a decade of specialized breast CT data, and its potential integration with future computer-aided diagnosis tools position IzoView squarely at the frontier of AI-empowered breast cancer detection. Commercialization IzoView for dense breasts. Izotropic Corporation has advanced its plan to commercialize IzoView, a dedicated breast CT scanner purpose-built to address dense breast imaging, a high-priority and underserved segment. Approximately 50% of women in the United States have dense breast tissue, complicating lesion visibility and increasing the risk of missed cancers. IzoView's design seeks to penetrate that gap through 3D volumetric imaging without compression and with improved contrast resolution. In regulatory and market strategy documents, Izotropic positions IzoView as uniquely suited for dense tissue, citing literature and prototype research supporting breast CT in dense contexts. Because many women with dense breasts derive less benefit from standard mammography, regulatory guidelines and advocacy groups are driving calls for supplemental screening. The environment increases the addressable market for improved imaging modalities such as IzoView. In investor presentations, the company emphasizes that IzoView could serve both screening and diagnostic workflows, initially launching and penetrating the market as a complement to tomosynthesis with MRI comparable images, before seeking regulatory approvals to replace these devices. IzoView's goal is to offer a platform that radiology clinics, breast centers, and hospitals can adopt for denser breast populations while managing cost, workflow, and integration. By focusing on this niche, Izotropic aims to align its commercialization roadmap with evolving medical guidelines and reimbursement pressure, a wise strategy for medtech entrants in specialty imaging. Scalability, modularity, and platform potential. One of Izotropic's key selling points is that IzoView is engineered for economic scalability and extensibility. Public disclosures state a target device sale price of $500,000 compared to legacy breast CT systems whose list prices reached $1.5 million or more. This pricing ambition would enable more widespread adoption in distributed and outpatient imaging environments. Izotropic has identified 14 indications for use in its roadmap, which support a strategy of recurring revenue via software upgrades, new imaging models, and evolving clinical applications across screening, diagnosis, monitoring, planning, and personalized medicine. This modular model allows the hardware base to remain stable while functionality expands over time. The system's modular engineering also supports deployment in high-throughput settings and decentralized care facilities. Designed to be self-shielded or no need for specialized radiation shielding infrastructure, and with streamlined patient workflows, the platform reduces barriers to entry in smaller clinics or regional hospitals. This opens global market opportunities where heavy infrastructure such as MRI suites and shielding rooms may be cost prohibitive. By combining a competitive device cost, upgradable architecture, and multi-indication expansion, Izotropic positions IzoView not just as a scanner, but as a platform, a base for future growth and differentiation. Durable advantage in AI reconstruction. In the AI medical imaging domain, Many innovations gravitate toward commoditization. Algorithms get replicated, open source models get tuned, and differentiation narrows. Izotropic's strategy counters that by relying on proprietary AI image reconstruction algorithm trained over 15 years of specialized breast CT data, held as a trade secret. In a market where many vendors share or license similar models, this kind of unique dataset and refinement can yield a durable competitive advantage. The algorithm enables denoised, optimized CT images while maintaining low radiation doses comparable to two-view mammography, a critical balance in breast imaging where radiation exposure is always a constraint. The combination of low-dose imaging, optimized reconstruction, and image fidelity is a key value driver when integrating downstream diagnostic AI. Indeed, the better the input data, the better any CADX or decision support tool can perform. Furthermore, the trade secret nature of the model helps avoid easy imitation or copying by rivals that rely exclusively on public AI frameworks. This creates a barrier to entry and helps Izotropic maintain a technological moat. Over time, as clinical validation matures, integration with diagnostic AI on top of that reconstruction backbone could deepen that moat further. Platform integration, AI ecosystem synergy. Izotropic's vision for IzoView extends beyond imaging hardware. It is structured to become a node within the large AI-enabled diagnostic ecosystem. The company holds exclusive rights to a patented computer-aided diagnosis module for breast CT, positioning itself to deliver not just images, but interpretation and triage. As imaging modalities converge with analytics and cloud infrastructure, IzoView's high-quality volumetric datasets become valuable training ground for AI partners. Radiology groups increasingly seek platforms that not only image but help clinicians interpret, prioritize, and act on findings. Because IzoView produces 3D volumetric data rather than 2D images, it can feed more robust datasets for AI training, including richer spatial context, finer lesion delineation, and better volumetric metrics. This gives Izotropic leverage when negotiating partnerships, data collaborations, and AI licensing arrangements. Over time, the device could act as a gateway for third-party clinical decision tools built on its imaging foundation. High-growth market and strategic positioning. The market opportunity supporting Izotropic is large and expanding. According to analysts, the global breast imaging market is projected to grow at approximately 8.6 CAGR between 2023 and 2030, reaching approximately $9 billion by 2030. Other forecasts estimate a market of $5.21 billion in 2024 to $10.37 billion by 2032, with a CAGR of 8.97%. In itself, that trajectory demonstrates robust demand for next-gen modalities. Regional breakdowns suggest North America will remain a leading market, driving adoption and reimbursement trends. Izotropic's own disclosures cite projections in digital breast tomosynthesis growing from $950 million in 2024 to $1.71 billion in 2030, showing a CAGR of approximately 10.28%. Izotropic is advancing a regulatory strategy aligned with the FDA, pursuing a modular, pre-market approval pathway and staged clinical data submissions. The company also publishes milestone roadmaps for its commercial launch plan. With a differentiated technology, trade secret AI, CADX potential, and scalable business model, Izotropic is well positioned to compete in a high-growth imaging market as long as the company can deliver on clinical validation, regulatory approval, and adoption by imaging centers.
This audio press release is an original broadcast provided by Investor Brand Network, a multifaceted financial news and publishing company that delivers a new generation of corporate communication solutions, including news aggregation and syndication, social communication, and brand awareness tools. Investor Brand Network may receive payments for the services and solutions provided to its client partners. You should assume that the owners, officers, and directors of Investor Brand Network or financial analysts mentioned in this audio production may hold a position in and may intend to trade the securities on their own accounts. This audio production is not an offer or recommendation to buy or sell any securities mentioned in this audio production. The information in this broadcast is presented solely for informative purposes and is not intended to be or should it be construed as investment advice. As in all investments, investment in the featured companies carries an investment risk. Listeners should review the companies thoroughly with a registered investment advisor or registered stockbroker. This audio production by Investor Brand Network is not purported to be a complete study of the featured company or other companies mentioned. Information used and statements of fact have been obtained from featured companies and other sources but not verified nor guaranteed by Investor Brand Network as to completeness or accuracy. Such information is subject to change without notice. Please see our full disclaimers and disclosures at investorbrandnetwork.com.